Hi, my name is Stephanie Belmer, and I'm a registered nurse in the Cardiac Cath Lab at the Brooklyn Hospital Center. Today, I'll be talking about hypertension, the silent killer, hosted by the Cardiac Cath Lab Nursing Department. Okay, so first let's talk about what blood pressure is. It's the force against blood vessel walls as the heart pumps blood. When the heart squeezes and pushes blood into the vessels, blood pressure goes up. It comes down when the heart relaxes. Blood pressure changes all the time. It's affected by rest and activity, diet, emotions, and certain medicines. I'm sure when you go to your doctor's office, they measure your blood pressure and give you a reading, say 130/80. But what do these numbers mean? The systolic pressure, or top number, measures the pressure when your heart squeezes. The diastolic pressure, or bottom number, measures the pressure when your heart relaxes. So what's normal and what's not? Typically, a normal blood pressure would mean the top number is less than 120 and the bottom number is less than 80. You would consider to have high blood pressure if the top number is over 130 and the bottom number is over 80. Any blood pressure where your top number is higher than 180 and or your bottom number is higher than 120, you'd be considered in a hypertensive crisis, and you should consult your doctor immediately. So, what exactly is high blood pressure or hypertension? High blood pressure occurs when the force of the blood pushing on the blood vessel wall is too high. High blood pressure causes the heart to pump harder, and it puts a lot of strain on the blood vessels that carry blood to the rest of your body. Hypertension is considered the silent killer because there are generally no signs or symptoms that you have it. A lot of people don't even know they even have high blood pressure. It usually occurs slowly over time. Although high blood pressure cannot be cured, it can be appropriately managed and controlled. If left unchecked, it can cause major damage to your heart, brain, kidneys, eyes, and other organs. So what are some of the causes of high blood pressure? Primary or essential high blood pressure has no known cause. For secondary high blood pressure, the cause is from an underlying or known condition. These underlying conditions can include kidney disease, diabetes, obstructive sleep apnea, obesity, thyroid disease, and lung problems. Some medications can also cause high blood pressure, such as birth control pills, over-the-counter pain relievers, cold remedies, and decongestants. Smoking, alcohol abuse, and illegal drug use can also cause high blood pressure as well. Stress, another major cause of high blood pressure. There are also several risk factors for high blood pressure. Some of these risk factors you can't change, such as age, race, and family history. Some of the risk factors that you can change include lack of physical activity, so get active. Obesity, try to get your weight down. Smoking, it's time to quit. Alcohol use, let's try to use moderation. Diet, eat healthier. Stress, try some relaxation exercises. And chronic conditions, make sure to manage them. There are some unique risks women can have in regards to hypertension. Certain types of birth control can increase a woman's risk for high blood pressure. There are also some increased risks in pregnancy for women who have high blood pressure. There's also a unique risk posed to African Americans. African American men and women alike have higher rates of high blood pressure than any other racial or ethnic group. They're also more likely to be hospitalized for high blood pressure. Even some medications are less effective at treating high blood pressure in African Americans. So what are some of the complications that can happen with high blood pressure? It could be heart attack, stroke, heart failure, weakening or narrowing of the blood vessels, or even difficulty with memory or understanding. So let's talk about how high blood pressure is diagnosed and some of the things your doctor will do when you see him. When you go see your doctor, which should be regularly, they will of course ask questions about your health and history. The doctor should check your blood pressure in both arms. It is important to note, high blood pressure should not be diagnosed in one visit to your doctor. Your doctor will likely take several blood pressure readings over the course of several visits to diagnose high blood pressure. Ideally, you should record your blood pressure readings at home. Your doctor can easily write a prescription for one, and most insurance companies do cover it. This would actually give the doctor a better idea of what's going on with your blood pressure. It should be done 3 times a day for 2 weeks. Then you should go back to your doctor with the readings. At this point, if your pressure is high, your doctor might prescribe medications for you to take, as well as advising lifestyle changes. Once you're on a high blood pressure medication, it is very important for you to take the medication as prescribed and do not miss a dose. It is also important for you to take your blood pressure 3 times a day on 3 different days during the month. This is to determine if the medications your doctor prescribed for you are working effectively. Doing this will also allow your doctor to make any adjustments to your medications. There are several ways to manage high blood pressure. As I just talked about, measuring your blood pressure on a regular basis, as well as seeing your doctor regularly, is one of the ways. Making sure you take your medications prescribed by your doctor is another way. Some of these high blood pressure medications prescribed can include diuretics or water pills, beta blockers, ACE inhibitors, and calcium channel blockers, as well as numerous others. Just to note, elderly people and African Americans tend to have a better response to calcium channel blockers to manage their high blood pressure. Managing your diabetes, if you're diabetic, is another way to manage your high blood pressure. Lifestyle changes are very, very important in managing high blood pressure as well. Some of these changes include quitting smoking, limiting the amount of alcohol you drink, getting regular exercise, maintaining a healthy weight, and your diet. Diet plays a big role in managing high blood pressure, especially a diet low in sodium or salt. Most salt in our diet comes from processed and prepackaged foods. Canned food, TV dinners, cold cuts, and fast food usually have a lot of salt in them. The American Heart Association recommends no more than 2,300 milligrams a day of salt, which is equal to 1 teaspoon of salt for adults with normal blood pressure. So for adults with high blood pressure, ideally you want to limit your salt intake to about 1,500 milligrams a day, which is a little bit more than a half a teaspoon a day. So as you can see from the slide, sodium math, a deli sandwich can have up to 2,810 milligrams of salt. Right there, if you have high blood pressure, you already went over the amount of salt recommended in one day with just one meal. That is why it's so important to read all the labels on the food you buy. You can also choose low sodium or no sodium added foods, which most of the time is indicated right on the front of the food label. Also, most fast food restaurants, such as McDonald's, indicate on their menu how much salt is in the food, so you can make a healthier choice. Now, I know some of you are like, I'm not going to start eating cardboard. And I know reducing your salt intake does not sound very appealing, but there are some things you can do to reduce your salt intake without taking away from flavor. Firstly, cut back on the salt intake slowly. Secondly, it's okay to indulge yourself every once in a while. Personally, I find taking everything away all at once is setting yourself up to fail. We all have been going through a lot lately and have been staying home more than we ever did before. So this could be a good time to spruce up on your cooking skills or even learn to cook. Cooking can really be fun and relaxing. So there are so many spices and herbs that you can use and add to the food that you will never even notice that there's a low amount of salt or no salt at all. Some of my favorites are cilantro, basil, garlic, cayenne pepper, and lemon zest or juice. I actually enjoy cooking. It relaxes me and it takes away a lot of stress. When I first started, every dish I made had salt in it. I started to notice I was always thirsty after, and I realized I was sensitive to salt. So I started to experiment with cooking with less salt and adding other flavors. I used to add a lot of salt to my tomato sauce. Now I don't even add salt at all. It's just olive oil, tomatoes, garlic, onion, black pepper, and basil. I love it, and so does my family and friends. Did you know that vinegar has no salt in it? I use vinegar in some of my chicken and meat dishes. Just be gentle with it. Some other things you can do is eat fresh fruits and vegetables. If you buy canned or frozen fruits or vegetables, you can, choose no salt added versions, or you can simply just rinse them off before using them. There are a few things that you can do to help prevent hypertension. You can eat a heart-healthy diet, low in salt, get regular physical activity, maintain a healthy weight, limit the amount of alcohol you drink, don't smoke, get enough sleep, and manage your stress. I hope this presentation on hypertension was helpful. We at the Brooklyn Hospital Center are here to help our community. If you'd like to make an appointment with one of our wonderful and knowledgeable doctors, please call the Brooklyn Hospital Center's cardiology department at 718-250-8627. We look forward to seeing you. Bye now. Stop share. Okay. And